If passed into law, Senate Bill 1268 would require hospitals to put a section on intake forms where patients could indicate whether they're a U.S. citizen. They could check yes, no, or no answer. Republican Senator Wendy Rogers says the bill she sponsored supports the Trump administration's efforts to expose government waste and combat illegal immigration. Data would be reported to state leaders quarterly to keep track of how much state funding for health care goes to non-citizens. Senator Rogers saying our state became overwhelmed treating patients who should not be living here in the first place, compromising the availability of health care for our law-abiding citizens. Personal legal status would not affect medical care or be released to law enforcement unless pertinent to an investigation. But the concept concerns the ACLU of Arizona.
We are not opposed to doing an accounting of what Arizona is spending money on. But the question is always, okay, you're collecting data. What are you going to do with that data?
And with immigration enforcement not off limits in sensitive areas like schools, churches, and hospitals, Jose Patino with the nonprofit Aliento fears it would dissuade people from seeking services.
We have had several cases already happening where individuals are not wanting to go to the hospital to seek attention, even though they need it.
Patino says he knows what's at stake. A DACA recipient, he was undocumented in 4th grade when he developed a non-cancerous stomach tumor. Since he was uninsured, Patino says clinics wouldn't treat him until the tumor grew to the size of a melon.
We had to wait until my life was at risk so that we can use emergency access because otherwise we couldn't have used it.
Today, if others also wait for care, he questions the long-term costs.
At the end, they're just going to be seeking an emergency care, and that's going to cost more to the state.
For ABC 15 Arizona, I'm Jane Caffrey.